Hi, my name is Tabitha Dussel, and my special population is oncology social work. The definition of oncology from the book of Gerlach and Brown, oncology social work is a specialization in social work that addresses the psychosocial responses and needs of individuals and families affected by cancer. So, cancer typically begins with damaged genetic material that leads to the growth of abnormal cells, and then the cells form tumors. Diagnosis is done through numerous different ways. It can be full examination, blood test, scans, and or biopsies. And by doing that, they determine which stage the cancer is in. This population is different from working with others as there is a big team of people all working on the same patient. It is important to collaborate with each individual on the team, and the team may consist of the physician, nurses, the radiation team, the pathologist, any other hospital type people that maybe we don't always, think about, um, and then obviously the patient and the patient's family. There are many other factors that people do not always think about once they're diagnosed with cancer, just because that's such a shocking diagnosis most of the time. So, other factors may be finances, mental health, and then whatever the other family's wants and needs might be. The social worker will keep all of these things in order by continuing to assess family needs and remaining in contact with the team. The social worker will also work very closely with the family in order to make decisions and ensure the patient has the best support and the best team possible. Like in the week 5 discussion, my peer had answered my questions of if an oncology patient shows up in the ER for something that could have been avoidable, maybe such as vomiting and just being really sick from radiation. If the physician maybe didn't let them know, they have to stay hydrated, maybe not to eat certain foods, or not to eat so long before or after receiving chemo, that the physician could potentially be the one that gets in trouble. Social workers should be part of the team right off the bat just because they can work with the patient and inform them of all of the different side effects. Not that it's something that the physician shouldn't be doing anyway, but at least the social worker could be doubling down on the information, just making sure that the patient has absolutely all the information that they could possibly need. Um, Cancer is a serious diagnosis. Again, it usually puts people into a little bit of shock. So maybe if they didn't understand the physician the first time, the social worker could re explain anything, or maybe even explain some things a little more in depth just to make sure that the patient is okay. One challenge I think would be when working with oncology patients is ensuring that the patient is not burdened or overwhelmed by finances. Um, Nowadays in life, obviously, everything is much more expensive, and I'm sure that cancer treatment is not far off. It's hard enough to hear the diagnosis of cancer, let alone have the stress of finances over your head as well, or the burden of something happening to you and your family being stuck with any kind of payments afterwards. Um, which leads to another challenge is making sure that the patient has a solid support system that doesn't only involve the treatment team, but family members or friends that they're hopefully close to enough to maybe rely on for transportation or something to chemo. I think another challenge for me would be speaking about end of life care. If the cancer is not treatable or curable, that's not something that I do now. So I think if I were to get into oncology social work, that would be something I would struggle with, and the first few times until I got used to a comfortable way for how I would approach that conversation. When working with this group to prepare addressing challenges and needs, I would have an in depth conversation with the patient to make sure that I have their priorities straight, um, making sure that I have all of what they need out of this treatment, what they want, and then just touching base on anything left to discuss if they happen to miss anything. I would talk to the patient about the stress management and talk about improving their quality of life, reducing their stress and anxiety, hopefully minimalizing hospital visits and helping reduce cost of care. So again, I would just discuss their financials, their mental health history, the different types of services in the area in case they would need any type of extra help, such as, paying for the bills or hospital stays or anything like that. And I would answer any questions that they had. If I didn't have the answers to their questions, I would talk to whoever I needed to get them the answer that they're looking for. If I were to get into oncology social work, um, as far as resources, I would need to do some research on different types of cancer and treatment. Um, Even in my area, I don't necessarily know everything ab- about the oncology options that we have. I know a lot of people usually have to travel out of my area because it's just tiny and we don't have like specializations like that so much around here. So again, I would have to get to know surrounding or the closest treatment providers, hospitals, doctors' offices, anyone who handles chemo and radiation and things like that. Um, to help me and to help the patient, I would put a list together for the different oncologists in the area and what they handle, what they do, what hospitals they would need to go to, and so forth. I think the patient would need to know the process of the treatment that they will be receiving, which I also think would help me for future patients that would be diagnosed with maybe just a different stage of cancer, but the same kind. I think that a timeline would help. So if they're going to do chemo and then surgery and then some radiation afterwards, or whatever their treatment plan would be, I think some kind of timeline would help them so that they know what's going to happen next and they have things to look forward to, especially that end date and end goal, hopefully being, in remission. I think a list of resources to help with housing, bills, maybe cash assistance, transportation if need be. Obviously, counseling services could also benefit the patient and knowing what kind of resources they have in their area. As a social worker, I think I would do okay in the oncology field. I think it would take a little bit of getting used to just because it's different. But I do believe I'm a good listener. I am very empathetic and understanding. I listen closely as to what the patient feels is a priority. And I think just having a listening ear sometimes really helps, especially when they may feel alone being that they have this diagnosis now. Oncology is different from basic case management as there is a much bigger team involved in the treatment process. It can also, again, be sad sometimes. Unfortunately, this type of social work requires talking about end of life care with the patient and their family. It's a sensitive topic that, obviously nobody wants to speak about, but does sometimes need to be done to alleviate the stress of the family and set the patient's mind at ease if they know that everything's going to be taken care of in case they would come to that for the end of their life. Here are my references from my article and then the book. Thank you.